Hi folks, this is Pejman. First, I apologize for my voice. I've got a cold, but I will try to do my best to have a good presentation. I always had loneliness and depression on my mind, among other things, particularly for the elderly who experience this illness as a result of loneliness. Of course, there are also some like me who worry about their family's well-being while studying away from home. Actually, millions of individuals around the world suffer from depression, which is a widespread and significant mental health problem. So I made the decision to work on this topic. My research question is, how does virtual reality affect depression? Rational and objective. The rationale is to explore the potential benefits of this technology in addressing the symptoms and improving the overall well-being of the individuals with depression. And the objective is to provide a better understanding of the potential benefits of VR as a treatment for depression and to help determine the most effective use of this technology for individuals with depression. Research suggests that VR can be used to expose individuals with depression to positive experiences and environments, which can help to improve mood and reduce symptoms. Additionally, VR can be used to simulate situations that may trigger anxiety or other negative emotions, allowing individuals to learn coping strategies and build resilience. Here are 5 articles and I'm going to talk about them. The first article research question is virtual reality exercise for anxiety and depression. This study reviewed literature on the effect of virtual reality exercise on anxiety and depression in various populations. Results showed that 4 out of 5 studies found a significant improvement in anxiety and depression measures following VR exercises, but existing evidence is insufficient to support its use as a standalone treatment over traditional therapy. The second article research question is the effectiveness of virtual reality-based interventions for symptoms of anxiety and depression. In this study, the meta-analysis studied the effectiveness of virtual reality interventions for treating anxiety and depression and compared them to control conditions or other active psychological treatments. Results showed that VR interventions were more effective than control at reducing anxiety and depression symptoms, but did not reduce treatment dropout rates, and the results were extremely diverse and possibly biased by publication. The third article research question is virtual reality for supporting the treatment of depression and anxiety. In this article, the authors conducted a scoping review to investigate the use of virtual reality technologies in the treatment of depression and anxiety, with a focus on the inclusion of cognitive behavioral therapy, CBT. They identified 34 relevant articles, of which 9 reported the use of CBT with VR and all found it to be effective in supporting the treatment of mental health conditions. The fourth article research question is embodying self-compassion within virtual reality and its effect on patients with depression. In this research, the researchers developed an 8-minute virtual reality scenario in which 15 patients practiced delivering and receiving self-compassion in different virtual bodies. Results showed significant reductions in depression severity and self-criticism and an increase in self-compassion from baseline to 4-week follow-up, with 4 patients showing clinically significant improvement. And the fifth article research question is preferences of virtual reality games in psychological pressure and depression treatment. This study aimed to assess the preference for VR games for stress and depression treatment using a discrete choice experiment. The study found that participants placed a high preference for VR technology for psychological intervention and considered factors such as the probability of adverse events and monthly costs when making their choice. This is the citation, and thank you for your attention.